Hi everyone, and welcome to the second lecture for week 4 of Contemporary Issues in Public Health. So we've been looking at chronic diseases in Australia, and what I really wanted to sort of start to touch on is that maybe as public health practitioners, policymakers, and generally the cornerstones sort of heavy lifters in trying to improve chronic disease in Australia, maybe we need to take a fresh look. And I think this is where it's an exciting avenue for you to be going into public health at this time, is that we've been trudging down the same road in terms of trying to look at prevention in chronic disease on an individual lifestyle level. And we know from the previous lecture that I just provided, it's not working. Things aren't changing, and we need to really have a little reflection as a profession and start to think about what we can do. So we know that the World Health Organization that has estimated that at least 80% of heart disease, stroke and diabetes cases are preventable. So why do we still have this great burden of disease in so many developed and developing countries? Okay, why is that? Like I said before, why is that rate still going up? Why is that trajectory still going up? What, as policymakers, what as public health practitioners are going wrong? Where are we going wrong? Let's sit down and have a look at this critically and think about what's a new angle we can start to look at this from. So it really comes back to risk factors, okay? We know that the chronic disease rates, the disability from chronic disease, is a product of those underlying risk factors. And those underlying risk factors have been the major target of a huge array of interventions over the last 20, 30 years. But how are we still missing the mark? Well, let's peel it back. Let's start with the positive, okay? We know that targeting specific risk factors can be effective, and we know this from the smoking rates, okay? And we know this from the reduction in lung cancer. That curve is going down, and it's going down quickly, and we know that we're having an effect from a public health perspective on reducing that rate of lung cancer and associated pulmonary disorders from reducing rates of smoking. And we know that we can see it's a direct result of public health campaigns, okay? So we've really see this as a success and started off with looking at the warning systems on packs in the early 90s. Excuse me, sorry. And then it's also looked at reducing smoke exposure, and then we're looking at plain packaging in the 2000s, and then also really still extending the rates of or the exposure to tobacco smoke through environmental restrictions. We're just continually seeing this drop off. So we can do it as a public health profession. We need to have a look at, take the positives from this and really revisit what's happening in different risk factors. So how are we missing the boat with other risk factors? Fruit and vegetable consumption, okay? We really know that we're not making big inroads into this. We're not seeing that huge drop-off that we are in smoking. We're still seeing an incredible high rate of consumption of unhealthy foods, and the base rate as a population for our general fruit and vegetable consumption is low. It's particularly bad in children, and that's getting worse. So what's going wrong? Okay, so there was quite a comprehensive report that I've put up as a reading resource for you this week, and it's really worth your while having a look through it. And it did a review of interventions, and it really found that from these programs, they're not cost-effective measures, okay? They're individual, they're behaviour-based, and they're not cost-effective, and they're not improving the health for whole populations. We really need to review how we're targeting fruit and vegetable consumption. And the same with obesity, okay? We're really looking at individual levels of increased activity, reduced fat intake, and even individual levels of individual pharmacology intervention. However, they're still not being effective. They're still not cost effective. And there's a full analysis of that report in this week's readings, and I would really urge you to go and have a look at this in more depth. Salt, another major player in all of this. High blood pressure, hypertension, yet it's just not hitting the public radar. I was sitting down the other day in a bistro style eatery in a rural, what would be classified as a regional town within Australia. And I sat there and I was gobsmacked to turn around and look at the amount of people within that bistro that had already a high salt content food in front of them, so chicken schnitzel with chips, that were adding additional salt. We're not getting that message across. And why and how that is, when I think we need to revisit as public health professionals. There's recently been a report or an approach put out by WHO, which is actually developed here in the Garvan Institute in Australia, a big body of work of how we can maybe start to put this on the agenda. Yet I feel like even with the release of this globally, we haven't seen much of a reaction here within our sphere in a public health locally within New South Wales, or even federally within Australia. It sets out some really fantastic policy key elements to target, and how we then implement those in Australia really needs to go out into the public health radar and really for us to take a hold of to reduce this risk factor. So a way forward. Well, I think this table is a fantastic look at what is doing well and what maybe we can also take from one risk factor, say to tobacco smoking or alcohol consumption, and you can see they're actually the tax end of things that are working, or maybe that policy upper stream big public health, population health target are making the headway, and maybe we really need to revisit this for other risk factors. In Australia, there is a preventative health strategy, but there's no clear pathway forward. And I think that you, as the next generation of public health practitioners, people working in the public health policy sphere, really need to start thinking about that. And it's also a political agenda. We need to get it more upfront. It doesn't win elections, but it is important for our health in the future. So instead of looking at interventions to target a whole populations or policies, maybe we need to look more at policies, okay? We really need to look at the cost-effective incentives for fruit and vegetable intake. Comes back to policies and politics. We really need to start advocating more greatly for these avenues to address risk factors. And it's needed on a number of fronts. It needs to be coordinated, sequenced, and connected. And it needs to be a strategy and sustained over a period of time. Can't be a 5-year grant that just looks at this, or a 10-year, not even that much, 2-year grant that implements this project. We need to come from a coordinated, long-term, sustainable point of view to actually start making a headway and reduce those chronic conditions. So where is it from here? I think that's up to you guys. I think the ball is in your park. It's an exciting time for you to be heading into the industry, and I think we need to be doing more from a coordinated perspective.